Hey, well, good afternoon and welcome back for our sixth now edition of our Centennial Year celebration featuring giants of physical therapy in Kentucky. We've had some great ones, most recently Larry Benz. So I encourage you to pull up on Facebook those interviews and enjoy. There's a lot to be learned from each one of these individuals that we've recognized over the last 6 months now. So I'm looking forward to today's episode. We'll share a story of an individual who's contributed tremendously to the development of our PT practice through a variety of mediums at a local level, at a statewide level, a national and even international level. So to provide you with a broad brush stroke of some of those accomplishments, Dr. Chuck Hazle, our new giant to be celebrated today, has been on faculty at UK since 2003 and carries experience as a director in outpatient clinics as well as large hospital facilities. He's co-authored textbooks, one of those imaging in rehabilitation and the other imaging for the healthcare professional. He's also contributed to the body of literature for our profession through multiple manual therapy topics, spinal and peripheral joint disorders, and more. But he's also served as one of our leadership as treasurer for the board of APTA Kentucky, formerly KPTA. So he's a busy guy, and we're honored to capture some of his time today. But before we jump into that dialogue, we want to welcome our chief delegate, Dr. Kurt Neely, who's been hard at work recently with the House of Delegates. And so we'd like to get an update from you, Kurt, if we can, on what's going on in the landscape of topics that are being addressed.
Thank you very much, Charlie. As Charlie mentioned, House of Delegates at the national level is in the beginning processes of being full swing. We just ended up our online component this past weekend. So we had the elections for our APTA national positions, and we will be in DC. If COVID allows, we'll be in DC here in a couple of weeks at the centennial celebration for the House of Delegates. In preparation for the House of Delegates, APTA Kentucky is going to host a town hall this coming Thursday, September the 2nd, 6 o'clock Eastern, 7 o'clock Central. The registration and Zoom links are available on APTA Kentucky's Facebook page, where we will talk about some of the motions and happenings of the House. We're in a bylaw revision year, so there's lots of discussion about the bylaws of the House of Delegates. Additional topics that have generated a lot of discussion in our online format have been diversity, equity, and inclusion, anti-racism and the APTA, physical therapy assistant and student groups allowing voting privileges in the House, productivity standards, and so many more topics. So if you are interested, have some questions, want to learn a little bit more about it, please tune in again Thursday, September the 2nd, 6 o'clock Eastern, 7 o'clock Central on APTA Kentucky Facebook page for the Zoom link. Thanks a lot, and I look forward to hearing from you guys on Thursday. I turn it over now to Beth Ennis to provide some centennial updates of the APTA.
Appreciate it, Kurt, very much. The big centennial celebration is rapidly approaching. We are going to be celebrating in DC starting on the 10th of September. They have put a lot of COVID precautions into play so that we can gather still safely, see the new building, and celebrate the centennial together. So we're looking forward to that. If you are unable to be there in person, and we recognize that travel restrictions are huge for a lot of people, they do have a live stream tour of the new building, which is absolutely gorgeous. They will be live streaming the House of Delegates so that you can watch that on the main APTA page. And several of the events are also going to be live streamed. I think the Future of the PT Profession conference is going to be live streamed. I think they're going to try and at least record the Mary McMillan talk that will be at the Kennedy Center to be able to broadcast that later as well. My final push, we do still have Kentucky bourbon, APTA Centennial bourbon available. So if you are interested, please visit the APTA webpage, the APTA Kentucky webpage. There is a purchase link there, and we will get it to you. Look forward to that celebration, but now I am very excited to turn the floor over to Charlie, our president, who will be interviewing Dr. Chuck Hazle.
Dr. Chuck, as formal as we can be, welcome. We are really honored to have you as a recipient of our Giants in Physical Therapy in Kentucky. The whole intent of this project is really to recognize the hard work and effort that people have put in over the last number of years, and you certainly are a great representative of that. So of note, I do want our listeners to know that when we first reached out to you to say, hey, our committee has voted and Chuck Hazle is the guy that we really want to celebrate, you're so humble in your response. And in fact, I think you may have said, is this an error? And no, it's not an error. We are very fortunate and privileged to be able to recognize you for all the work that you've done, not just within the state of Kentucky, but I see your face now on the national level, doing a number of webinars as it relates to imaging alone. And I've had the opportunity to kind of read back through some of the publishing and research that you've done as well. So congratulations to you, but we are excited to welcome you here.
Well, thank you, Charlie, and thanks to the committee who had input on this. Yes, I did think it was a mistake because I can think of dozens of other people who warrant this kind of recognition more so than I, including several on the UK faculty. I thought you may have copied down an email address of someone else by accident. So,
well, we're interested to learn just a little bit about you, so we're going to jump into it. First question that I want to throw out to you is, how did you get into physical therapy? And you've had a very interesting career path where you've had a lot of clinical experience, and even as a director for outpatient, as we mentioned, and even in a large facility like a hospital. But then you've had academics as well as research. So tell us what got you into physical therapy and how has it crafted your career?
Well, I had a very tortuous path to get to physical therapy. My initial chosen profession was actually in athletic training, but I became a little bit disillusioned with that. And when I graduated from Indiana State in 1983, I actually went to work in what my degree was related to in environmental health. And I actually worked for state government in the safety of drinking water for 5 years. And sitting behind a desk for 5 years, and well before that, is I realized this was not really the career path that I wanted. And so I went back to what I was interested in. As some of your other giants have mentioned, I've always just been fascinated with the human body. And seeing the opportunity to, we will so often hear, is that we want to make an impact somehow, some way. And so I thought I was going to be a little unusual in being a non-traditional student. But in my particular class in PT school, my age, starting PT school at 28, that was the average age of our class. We had many non-traditional students, but I think that's a fairly common occurrence, that you have students who have gone other routes in life and then they come to physical therapy, in essence, to find the path that they want to follow.
That's interesting. So should we be drinking Dasani, Deer Park? Should it be tap water?
Well, the whole bottled water versus tap water issue is far beyond what we can cover today.
Well, if you could, can you share with us some of the avenues that you've been busy and involved in our profession? I know we mentioned, obviously, you serve on KPTA Board of Directors. If you could share with us some of the various avenues that you're currently involved in or that you have been involved in.
Right. I was very fortunate in having only been out of school a couple of years and was nominated for treasurer of KPTA at that time. And Richard McDougall, Mac, stood up and advocated for me to be elected to that position. So if we reflect back on who were key people, I think you can start with that being one instance, and most recently I've been involved with the Imaging Special Interest Group of the Academy of Orthopedic Physical Therapy. I'm finishing the final few months of my second term for a total of 6 years as president of that group. And one of the things that of course, we're about physical therapists having imaging referral privileges and also utilizing diagnostic ultrasound. But it's not just about that. It's really more so about physical therapists being the primary care providers for patients who have musculoskeletal problems. We want to have the practice model, I think, very similar to what the Australians have, that if you have a musculoskeletal issue or an apparent musculoskeletal issue, you don't go to your primary care physician, you go to your physio. Um, and what we're looking for is for us to have that practice model. And if imaging is necessary, rather than going through this complicated path of multiple steps of other providers, that physical therapists could refer for imaging if that is warranted to assist in the decision making in patient care. So it's really not just about imaging, it's about the overall practice model.
I've been impressed with the work that you've done there. It certainly gives a broad brush of not just what's happening amongst the United States, but even internationally. I think is a good vision overall. But we've really only had just a few states move forward with legislative components. Is that correct?
Correct. Currently, there are 8 jurisdictions that have imaging referral privileges. 4 of those have been by legislative initiatives, and then the other 4 have had their practice acts interpreted to be inclusive of imaging referral. And because of what has evolved, North Dakota just this year, Rhode Island just this year, there is a rising tide of interest nationally in states for states to have initiatives for imaging referral privileges for physical therapists. It's gathering momentum, and we see more and more states beginning to examine the process, whether they want to do it legislatively or whether they want to go through a regulatory perspective, going through their board, or there are a number of avenues, but more and more states are beginning the process of examining what will it take for us to accomplish this.
And that's where we are for Kentucky. In fact, Kentucky's been closely monitoring the education and information that you've been putting out, along with the group that you just recently did a wonderful webinar on in regards to imaging. And so we'll be tapping on your shoulder to say, okay, where does Kentucky stand with this? And can we be part of that rising tide? So
Right.
We look forward to moving in that direction.
Right. And, we see this happening nationally. Now that this surfaced on the Federation of State Boards of Physical Therapy, it was part of their educational series this summer. And then just a couple of weeks ago, the American Physical Therapy Association, with one of their state affairs webinars, imaging was included. So again, it is definitely creating greater interest across the country.
Well, UK's had a recent graduation of new students going out into the profession. And of course, we have many up and coming young folks considering physical therapy. What advice would you give to the new professionals going out into the field, as well as should people be considering physical therapy as we look towards the future?
Well, we're certainly continuing in a very interesting time now in all the health professions. There are a couple of things that I think are very important for students about to become novice clinicians and moving forward in the profession. One of the things is I think there are so many opportunities to learn. There are opportunities to learn. Sometimes they're obvious, sometimes they're more subtle, sometimes they may even be hidden. But explore as many opportunities to learn that you can and seize those opportunities. The other thing is, this is one of those that we could categorize, I wish I knew then what I know now. And I knew it to some degree then, but I certainly didn't know it to the extent that I should have, this is really a profession that is all about relationships. Now, we have the obvious examples of the clinician and the patient relationship, but it's also the practitioner with all your coworkers, with other providers in the medical system, with the community in which you practice, with your state association, with people on a national and an international perspective. There are so many opportunities to form relationships, and if you cultivate those relationships, you get so many more opportunities to move forward in the profession and you have opportunities to serve people as well.
I love that perspective, in part because, oftentimes people look at physical therapy as an opportunity to go into pediatrics or orthopedics or neurology or academia, maybe research, but that's a nice total capture of relationships is what it comes down to. So really good perspective there.
Thank you.
Overall, I'd be curious if you could tell us at least one special highlight in your career that potentially you could point out that really drove you to take on some of these larger roles as a leader in our profession.
I can't say that there really is one moment. There have been a series of situations where hard work, opportunity, and good fortune have come to confluence and allowed me to be involved. Um, Not so much in leadership, but what drove me to be so committed to the profession was I can think back in that first year or two that I was out of school, and I would go home at the end of the day so frustrated and angry that I did not have the answers
Hmm.
for my patients. And that just drove me to try to learn more and more. And at some point along the way, I just committed to that I'm going to stop telling my patients I don't know what to do for them. And so I became very assertive in trying to learn as much as I possibly could. Of course, at that time, now we're sneaking up on 30 years ago, we didn't have the structure that residencies and fellowships and all of that. You had to go get it on your own. And so I would go to 5 or 6 continuing courses a year, mostly out of my own pocket. And I would also, we didn't have the access to information like we do on the internet now.
Mhm.
And so I'd go to the Med Center library, take a couple of rolls of quarters, dig through the journals, copy articles, 10 or a dozen articles, and bring them home and read them. But it was, the inspiration really came from my patients and not being able to help them the way that I thought I should be able to. And then that created opportunities. And again, I've been very fortunate to meet people who have entrusted me and provided me opportunities along the way. I mean, Linda and Wally Langley, who entrusted me to run an outpatient clinic in Winchester. Art Nitz, who called me up and said, "You want to teach some labs?" And I thought, who, me? What am I going to do? Well, put some things together. You can do it. And then that evolved from one class into 2 classes to 3 classes to 4 classes, all while I was still running a full-time outpatient clinic and doing on-site industrial intervention at 3 plants at all 3 shifts. So there have been a number of opportunities that have come along, and it really is a matter I've been in the right place at the right time.
Well, what I hear is you saying, obviously, you were there to serve your patients, and that's evolved to you serving other patients through being a leader, not just within our association, but within our profession. And so being such a great resource for our students, but also our professionals that are out there is one of the things that we admire most about you. You mentioned a couple of people. Is there anyone else that has really served as an advisor or a mentor or somebody that you've had confidence that you had to tap on their shoulders or that's helped you along the way that you'd like to talk about?
Well, from a technical aspect, I've been very fortunate to have learned a great deal from Jim Meadows, who was in Canada at that time. I've also have an interesting story that is truth stranger than fiction of how I connected with Neil Tuttle in Australia. And, the opportunity arose in 2003 when Terry Malone was the program director. He said, if you take on this position, this full-time position, we'll sponsor your PhD. And so, again, opportunities that abound from people who have entrusted me, given me responsibility, and I'm forever grateful for all of those individuals. There are so many. When you described for me what this was going to be like, and I started going through my mind, and my list just kept getting longer and longer of all the people to whom I'm indebted for being so critical in my development in this profession.
Chuck, the big takeaway for me and just in what I've heard today is it's all about relationships, for those that you're connecting with that help move your career along, to the patients that we're working with, and then your servanthood leadership to be able to share the knowledge that you have with everybody else is just really admirable. So we just appreciate the time that we've been able to hear your story a little bit, and all of your sacrifice that you do. It's a lot of time and effort to put these talks together that you do, writing books, and research is very time involved, and you've done all of that. We've been very impressed with the work that you've done. We thank you for how you've contributed to not just the profession, but even our association as well. So thanks for your leadership. We appreciate your time today.
Thank you, Charlie.
We want to thank everybody for listening today, and we intend to have an episode 7 coming up very shortly. So please plan to join us in the future, and hope you enjoyed today's talk with Chuck Hazle.